We're going to dip into this teleconference Dr. Bright is holding, flanked by his lawyers, and see what's being said right now.
At BARDA, who are hyper-focused on a single mission to save lives by protecting both our national security and the health and safety of people around.
We're going to dip into this teleconference Dr. Bright is holding, flanked by his lawyers, and see what's being said right now.
At BARDA, who are hyper-focused on a single mission to save lives by protecting both our national security and the health and safety of people around the world. I've spent my entire career studying, preparing for, and leading pandemic preparedness and response. I've learned and I've served in various roles in government, in industry, and global organizations before joining BARDA in 2010 to lead our nation's effort to develop tools to respond to a pandemic. It was my job to ensure that our country had life-saving tools to be as prepared as possible for a pandemic like COVID-19. And to date, my team at BARDA has formed over 40 industry partnerships to accelerate the availability of tests and treatments and vaccines to address this pandemic. The past few years, however, have been beyond challenging. Time after time, I was pressured to ignore or dismiss expert and scientific recommendations, and instead to award lucrative contracts based on political connections. In other words, I was pressured to let politics and cronyism drive decisions over the opinions of the best scientists we have in government. And ultimately, I was removed from my position because of my continued insistence that the government invest funds allocated by Congress, hard-earned taxpayer dollars, to address the COVID-19 and invest them into safe and scientifically vetted solutions, instead of funding projects that were promoted by cronies or politically connected companies. Most recently, I witnessed government leadership rushing blindly into a potentially dangerous situation by bringing in a non-FDA approved chloroquine from Pakistan and India, from facilities that had never been approved by the FDA. Their eagerness to push blindly forward without sufficient data to put these drugs into the hands of Americans was alarming to me and my fellow scientists. I could not, in good conscience, ignore the scientific recommendations to limit access to those drugs under the direct care of a doctor, and instead allow political ambition and timelines to override scientific judgment. And that was just one of the many improper things that I pushed back on with senior leadership within HHS. We are in an extraordinarily difficult global crisis, and the worst might still be ahead of us. There are many scientific questions yet to be answered. We need strong leadership. Americans need to have all the facts. They need to know the truth about this pandemic. They need to be able to trust that their government and the information that they hear from politicians is based on scientific merit. The American people are strong and resilient. We can handle the truth. With accurate and consistent information, Americans can be empowered to help find solutions. We need to reestablish trust in our government and in each other. By working together, we can end this outbreak. We cannot afford to silence and dismiss scientists in our country and to strain or sever our ties from scientists around the world. There has never been a time in our life where their voice has been needed more. And our scientists need strong leadership too. Leaders who provide them with clear and consistent guidance and communication, leaders who trust their professional scientific judgment, and leaders who refrain from pressuring them to ignore science, to bend the rules, and to prioritize politics above all else. It is inappropriate to place dedicated scientists in crosshairs. Today, I am asking for the special counsel to investigate what happened to me and for this administration to reinstate me in my job as the director of BARDA. Our government's focus right now should be on saving lives and ending this pandemic. We are in a race against the virus, and every day counts. It is my sincere hope that my team at BARDA will be able to continue their race to develop safe and effective drugs, tests, and vaccines. And that's an endeavor that requires all hands on deck approach. Thank you.